everyone, Buki Ademola with you again on OET Success Tips. Today we want to look at a general guide on anticoagulant therapy. But just few tips before we go into that. In your role play, always have it in mind that your patient is the focus. And be prepared. Sometimes your patient bring questions that are not part of your role task. Be prepared to attend to such questions in a non-judgmental way, but at the same time, modify the discussion in a way that you are not diverted from your main task. So that is just the tips I have for today. Now let's move on to anticoagulant therapy. Part of the approach in your OET speaking is to make it simple as possible to convey understanding, free of jargons or complex language. So that is what I'm going to be doing as regards the anticoagulant therapy. I'm going to make it as simple as possible, just a general guide in case you have a role play on anticoagulant therapy. So what is anticoagulant therapy? Anticoagulant therapy is a form of treatment that helps to prolong the clotting time to about 2 to 3.5 times longer. It means it prevents the blood from clotting easily. Now, in a simple term, it is referred to as blood thinners. Why do patients need anticoagulant therapy? Of course, we all have clotting factors in the system. When you have a wound cut, the clotting factors comes into play. In total, we have 13 clotting factors, and they are called in Roman numerals 1 to 13, and it combines with some chemical process in the body. We are not going into the details. To make the bleeding to stop whenever you have a cut. The end stage of the chemical process, we have the fibrinogen, which is a soluble protein converted to fibrin, which is a solid protein. So this helps to stop the bleeding. So some complications could arise when clots are formed in the blood vessels. Some of the complications could be referred to as deep vein thrombosis. Thrombus, like clots are formed in the deep vein. And this could lead to pulmonary embolism when the clots or thrombus escape into the pulmonary circulation. As the blood circulates around your body to go into the lungs, the clots could escape into the lungs and it causes pulmonary embolism, and this pulmonary embolism could lead to cardiac arrest. And in some cases also, the vessels that supplies the heart is blocked. We have cases of myocardial infarction. There is insufficient oxygen and supply of blood to part of the heart. And in some cases we have stroke. The vessels supplying blood to the brain could be obstructed, and we have cases of stroke. So these are all the things that anticoagulant therapy helps to prevent. So now, part of the basic things you need to do before you start your patient on anticoagulant therapy, or the counsel to give to your patient starting on anticoagulant therapy, you need history taking. For your OET, remember, for your role play, you have just 5 minutes for your role play. So you don't have the time to go into detailed history taking, but you just have the focus to take the history related to your task. So if the patient is going on anticoagulant therapy, what are the general history you need to take from the patient? Number one, a pregnant mother or someone who is pregnant can't be on warfarin. We have two popular types of the treatment. We have warfarin, which is oral tablets, or referred to as Coumadin, and it comes in different strengths and different colors just to make it easier for patients to take the right dose. So warfarin is contraindicated in a pregnant patient. So you want to find out if your patient is pregnant, part of the history related to anticoagulant therapy. You need to check for history of blood disorders like thrombocytopenia. You need to check for history of GIT bleeding. Any form of bleeding, needs to be taken into consideration if a patient is going on anticoagulant therapy. History of alcohol consumption, if a patient is taking alcohol, all these are part of the histories that need to put into considerations, just in focus and in relation to the main task we are to carry out in your role play. Now, what are the general guide, what the advice we need to give to a patient that is starting on anticoagulant therapy? Now, just like I said, the common type, we have the warfarin, which takes a longer time to be effective, what they call therapeutic effect. So, but most times, patients that will be taking this medicine on their own is likely to be on the warfarin, which is the oral tablet. So we're going to take it from that side, and this also applies even to the injection type, which is heparin, which is given subcutaneously. So the general advice for your patients starting on anticoagulant therapy: number one, it is advisable that the tablet is taken same time every day, and sometimes it is indicated that it is taken in the evening time, like 6 p.m. every day. And why is the patient advised to take it 6 p.m. evening time every day? This is just to make sure there is a short time between when the last dose was taken and when the next test will be carried out. There is a test that is carried out on patients on anticoagulant therapy. We can call it prothrombin time. It is called prothrombin time. And from this prothrombin time, they can calculate the INR ratio, which is international normalized ratio. It has to be at the therapeutic range to be sure, as much as we want to prevent clots, and at the same time that the patient is not at risk of bleeding. So this has to be checked based on the treatment level of the patient. So the second point is, it is advisable not to take a double dose. So in case your patient miss a dose, if it is within 8 hours and the patient remember that, oh, I forget to take my due dose, within 8 hours it can be taken. But if it is more than 8 hours, it is strongly recommended that a patient skip the missed dose and wait till the next due dose and take the due dose. So it is strongly recommended that you do not take a double dose. Now, let's move on to diet and drugs. Anticoagulant drugs like warfarin, has that ability to interact with other drugs and even some food items, especially food rich in vitamin K. Vitamin K is an antagonist to warfarin tablet. So it is advisable, it is recommended that you do not take food supplements that are rich in vitamin K, especially green leafy vegetables. And your dietitian or nutritionist can help to guide you on this. So if you are taking a diet that is highly rich in vitamin K, This will act as an antagonist to the treatments, to the aim of treatments your doctor is trying to achieve as regards your health. And also about supplements, especially about supplements that are rich in vitamin K. You need to confirm with your health practitioner, your doctor, before you could take. It is not even advisable, but at the same time, you should confirm with your doctor. Over-the-counter drugs such as aspirin, brufen should not be taken concurrently when you are on anticoagulant treatment, because aspirin also have the tendency to act in the same capacity just like warfarin. So that is why you need to be careful with taking any drugs or any food supplement that are rich in vitamin K. And in case you have any appointment with any of the healthcare provider, let them know you are on anticoagulant therapy, especially the physiotherapist, your dentist. They need to be informed, they need to be aware that you are on this treatment. It is advisable and a good idea to carry your anticoagulant alert card. There's a special card that gives an information about you that you are on this treatment, especially in case an accident happens, so that your doctor knows you are on this treatment. If you bleed for more than 10 minutes, and the bleeding is not stopping, you should report to the emergency department or call the ambulance, seek for help immediately. You are strongly advised to be careful of any activity that can result in wound cuts, accidents, even including some games like baseball. You need to be careful with this because you have the tendency to bleed more. So take every precaution to prevent any unnecessary bleeding. And sometimes, in case you sustain any cut or any wound, try to apply pressure on the wound to stop the bleeding. So all these are some of the things you need to put into consideration when you are on anticoagulant therapy. And it is your doctor give you an appointment of how often you need to follow up on your PTA test, the protobin test, and also they calculate the INR ratio to be sure you are maintaining the desired therapeutic range. There will be a leaflet, a special leaflet guide that is given to all patients on anticoagulant therapy, which gives you a detailed idea and guidelines of how you can be careful and to take care of yourself. Some complications could arise, like bleeding in urine, where you notice your blood in urine, coughing out blood, vomiting blood. All these are indications towards the fact that you are bleeding beyond the therapeutic level that is targeted as regards your health. So if this happens, you need to see the doctor immediately. I hope this helps even as regards your anticoagulant therapy. If you find this useful, click like, click on the notification button so you get the information anytime I upload a new episode. Thank you for your time. Bye for now.